We love spending time with Dr. Stephen Marsh during our lunch hour, and I know so many viewers enjoy seeing the before and after pictures, Doctor. We're going to get to some of those, but we're just a couple of days away from Christmas, and a lot of our viewers are saying, all I want for Christmas is my two front teeth. Question, when someone comes and sees you, how do you know and how do they know how many teeth they really should get done in order for that full look smile?
Well, so that's a very interesting question. It really depends on what they present with. If somebody had a root canal, sometimes the tooth will turn dark, a single tooth. It's very hard to match one tooth. We'll often do the two front teeth in order so that they sort of mimic each other. If somebody has a wide smile, you may want to do 8 or 10 veneers or crowns to blend everything in. Just this week, we had somebody whose two front teeth had rotated a lot. She said, I've been thinking about it for years. Can we do something? So we're going to reshape and veneer them. The other teeth are in perfect alignment. The color's good. So we're just going to do tooth. So it all depends on what a person's needs are. And again, what they want, what their expectations are. And we try to match our expectations with theirs.
Well, seeing is believing. Let's take a look at some of the patients you've recently helped. Here we go.
Thanks. So this is Olivia. And Olivia had, I mentioned dark front teeth. Her two front teeth had actually turned very dark. She had had root canals, Joe. When she was about 15, she dove into a swimming pool, knocked the front teeth. They actually did root canals. And over time, the teeth had turned dark. They tried to match them with some bonding. You can see that didn't work very well. So we actually just did those two front teeth, a little gum contouring so things looked a little more even. And she's bleaching or whitening the others to bring them up because she's really wanted very bright teeth.
Very, very nice. Awesome. Okay. And who's next?
So this is Kathy. So Kathy has a wider smile. She said to me, can we just focus on the front 4 teeth? So that's all we worked on in this case, Joe. She wants to stage it out, and we can do that in today's dentistry because of digital dentistry, that sort of thing. So we worked on the front 4 teeth. We did 2 crowns on the front. We reshaped the laterals, the 2 next to them, did some bonding to give her that beautiful smile. She said she should have done it years ago, which for us was very gratifying.
Yeah, beautiful. What a transformation. I love these. I really do. Okay, wow. Talk about a transformation. Tell us about this gentleman.
This is John. And John, you can see how dark the viewers can see it on the viewer's right, but that's his left front tooth. And again, he had also fallen, had hurt the tooth. The nerve and blood supply had no longer continued, and that's what happens sometimes. Very dark tooth. You can also see some of them are short. His eye teeth, that we call them, are very long. We just reshaped those, and actually, Joe, that's actually a temporary 4-unit bridge. We haven't gotten to the finished touch, but just to show him what he could achieve doing it, gave him an idea. And he said to me, when he wore it home, his wife loved it. He said, I should have done it years ago. I didn't even know something could be done. I thought I'd have to have that tooth taken out. We were able to, again, reshape it. And then with these crowns and bridge work, we're able to make it look normal.
He's got to be thrilled. No doubt about it. Okay, who's this?
So Lisa had a big space between her front teeth. She and her mom wanted us to do something for her. She wasn't ready to go through braces. She was approaching her wedding day, actually. And we did 4 porcelain veneers to give her that smile. Again, her back teeth were in wonderful shape. We talked about how many can you do. We couldn't just do the 2 front teeth like we talked about for Christmas because those teeth would have been excessively wide. So we did the front 4, moved everything sort of towards the middle to give her that beautiful smile, and one that she's thrilled with.
Gorgeous. We have time for one more.
Yeah, so the last one is Angela. And Angela for years wanted to have a brighter, whiter smile. She had had 2 crowns. We talked about 2 front teeth again years ago. They didn't match. She never liked the way they could be put together. We ended up doing 10 on Angela. She has a big, wide smile. She meets with a lot of people. She said, if we can do them, let's do them bright. So we started with the top 10. We then do the lower, actually 10, though we don't have it in the picture. So those 2 front teeth started her on her journey, so to speak, to give her a beautiful smile.
Well, if you want for Christmas 2 front teeth or more, why don't we make this a New Year's resolution for you for 2021? Give Dr. Marsh and his team a call at 440-461-1003 or simply log on to the website clevelandsmiles.com. Doctor, happiest of holidays to you and your team.
Thanks. And I appreciate your having me and giving me the chance to tell people about what can be done with their smile.
We love it.